Hi, welcome to our chat today. I have a special guest. Well, it's special to me because I think that we are kindred spirits. The more I hear her talk, the more I see myself in what she says. And we're both extremely busy ladies. We had been trying to schedule this for a couple of months and it just took us a while to get together. So I'd like to welcome Dr. Amie Hornaman to our broadcast today. Amie is the Thyroid-Fixer, and I love that term. She is the host of a podcast. She is a doctor of clinical nutrition and a certified functional medicine practitioner. She specializes in helping people optimize their health, specifically optimizing their thyroid hormone and their sex hormones there, just really getting to a place of a better health. So welcome, Dr. Amie, and thank you for joining me.
Well, thank you for having me. Pleasure to be here.
So let's start with what got you interested specifically in thyroid and hormones and optimizing that part of health.
Yeah. So, like many of us, pain to purpose story. So many people in this space have gone through something that leads us to specialize and help others. And for me, it was a 25-pound weight gain followed by 7 different misdiagnoses. So this all happened over 20 years ago when I was competing. I was competing in figure competitions. And for those who don't know what that is, kind of like a toned down bodybuilding competition where you still look very feminine, but you have to diet down. Your diet is still very strict. It's chicken, it's broccoli, it's asparagus. You're hitting the gym twice a day. And I'd done plenty of these. I'd done that. I'd done fitness modeling. So I knew how to get my body into that shape, into that level of kind of a high performing shape. This one competition I was getting ready for was a really big show. I was working with a coach because we all need coaches.
Absolutely.
Can't do it ourselves, right? We all need help. And working with the coach, and I have to send in my weight and how my workouts are going. So I step on the scale and it's going up. It's up 5 pounds. I'm like, okay, well, this isn't right. Didn't even biologically make sense based on what I was eating and what I was doing. So I thought to myself, well, what I'm going to do is eat less and exercise more because that's what we do. And especially as women, right? Restrict. Push ourselves harder and restrict. Well, that didn't work because the following week I step on and I'm 10 pounds heavier, 15 pounds heavier, eventually 25 pounds heavier. So I had to stop getting ready for the show because I needed to find out why my body was rebelling against me. So I did what we all do. I went to my doctor thinking that if I say like, hey, doc, you know what, this is going on and doesn't really make sense. Here's what I'm eating. Here's my caloric intake, whatever. He ran some tests and came back with, you're fine. Just eat less and exercise more. I'm thinking, yeah, I really actually don't even think it's possible, right? It's not even. So I left there and I kept plugging away. I'm like, I'm not going to accept that answer. I'm going to go to doctor number 2, doctor number 3, 4, 5, 6. Doctor number 7 actually touched my throat and said, swallow. Doctor number 1 through 6 didn't do that. So doctor number 7 touches my throat, says swallow. And sure enough, I have a goiter. And she says, you have hypothyroidism. Here's a pill. We're going to send you for an ultrasound. And I leave that office and I'm pumped up. I'm like, yes, I have a pill. I have an answer. I'm going to lose weight now. This is awesome. 5 months go by, nothing. Not a single pound is lost, nothing. And I wish, oh, Amanda, if I could go back and see the tests that they ran. They only ran TSH. Yeah. You know that, right? So then I find functional medicine. It's like the universe, God, higher power was bringing me this practitioner because I kept hearing his name. So I finally gave in. I went to see him. He is now my mentor. Well, he became my mentor. He's retired. He's in his 80s now, but he became my mentor, totally saved my life, was practicing functional medicine before it was a buzzword, and did all the things that needed to be done. So I was put on the right thyroid hormone replacement. I still needed the medication, which I like to call thyroid hormone replacement. Put me on the right blend with the right dose, looked at my supplements, looked at my food, looked at my lifestyle, right? All the things that should be done to get
Mhm.
someone optimized. And he totally saved me. So that's why I'm here today, because even back then I thought, and I was at a major city with a huge hospital system. I mean, Pittsburgh, PA, UPMC. I mean, it's well known that that is a major, it's kind of like a Mayo Clinic, Cleveland Clinic kind of thing. And
Mhm.
I still couldn't get help. So I'm like, here I am in this big city. I'm not getting help. How many other people are getting misdiagnosed, and how many other people are stopping at doctor number 2 or
Mhm.
1 or 3 or 5 and just accepting like, well, this is it. I guess it's just all in my head, right? So that's
Mhm.
why I'm here.
Yeah. Well, some things that I take away from that story is one, we have to be our own advocate. No matter what your symptoms are, what you're going through, what your health issue is, you have to be your own advocate. And if your provider is not listening to you and you don't feel heard, you got to keep going until you find somebody that listens to you, because health is wealth and health is longevity and, our ability to be with our family and friends. And so if your provider's not listening to you, keep going, keep pushing. Um,
100%.
yeah. So I remember reading your story. You're only 5'2", which I'm 5'2" as well. So
Yeah.
25 pounds on 5'2" is a huge deal. I can't imagine just suddenly in a couple of months going up by 20, 25 pounds. I mean,
Yeah.
that was probably devastating at that point, for your career, for everything. That was devastating during that time. And from working with patients who have had thyroid disorders or any disorder, they often feel when they get that diagnosis and they get that pill, okay, there's that answer.
Yeah.
But from reading your story, it's way more than just that pill. Just because you may supplement that one hormone doesn't mean everything just suddenly falls into place. It's a complete lifestyle or a complete package of things that you have to do to kind of optimize and reverse illness once it sets in. So let's start with common symptoms with thyroid, because I often get patients that come in and say my thyroid's off, and I look at their labs and I do way more than a TSH. So I generally, and you can tell me if I need to do more than what I'm doing. If someone feels like they have a thyroid dysfunction, I'm doing a TSH, a free T3, a free T4, thyroid antibodies, and a reverse T3. That's kind of my panel that I
That's
do.
it.
And just because your TSH looks good doesn't mean the rest of them are going to be great. And honestly, even if they all fall in normal range, doesn't mean that that's the best range for you. Your numbers may need to be at a different level to make you feel good. So, one, is there anything else? There's nothing else you would add to that panel for a
No, you
thyroid panel?
nailed it. Yeah. No,
All right,
absolutely.
awesome. And then, so someone comes in, the main complaints I get is weight gain and fatigue. But what are the other things that people may notice when their thyroid is not optimal?
Yeah, no, those are the 2 biggies, the weight gain and the inability to lose weight literally no matter what you're doing. So
Yeah.
very similar to my story. I mean, you could be restricting, you could be on the perfect, like, healthy baby mama, trim mama diet in the world, and it's not working. And even I've had some patients that are on what I lovingly call, I have so many names for things, but what I lovingly call the Beverly Hills soccer mom weight loss drug of choice, Ozempic and
Mhm.
Mounjaro. And they are on these injectables that are pretty foolproof at losing weight, and they are not losing.
Yeah.
And girl, I gotta tell you, that is a huge red flag that there is something going on in the body, and it's usually the thyroid. So
Mhm.
those are the big ones: fatigue, hair loss, hair thinning,
Mhm.
constipation,
Mhm.
depression, anxiety,
Mhm.
joint pain, muscle pain. I mean, the list goes on and on. But if you think of hypo, low, and slow,
Mhm.
everything slows down. So gastric motility slows, your brain function slows. So brain fog, depression, but
Mhm.
even anxiety, people will say, maybe I'm hyper. It's like, no, you're not
Mhm.
hyper. You just don't have that brain regulation, because the brain has T3 receptor sites on it too, thyroid hormone receptor sites.
Mhm.
So that's a big one. And then there's some weird symptoms that can tie into thyroid. Like I mentioned, the joint pain. My
Mhm.
executive assistant was a patient first, and she never told me that she had trouble holding a pen. But
Oh.
she told me after, she's like, when we cut out gluten and you fixed my thyroid, I just figured I had, some kind of arthritis. It was genetic overuse, something like that.
Mhm.
But she could then grip a pen again without pain. So joint pain is a weird one. And then rashes, histamine intolerance, like a high reaction to allergens or food allergies.
Mhm.
That's another big red flag too.
Mm. I hadn't thought about the food allergy and the heightened histamine response, things like that. And you mentioned the GLP-1 class of drugs for weight loss, which in my clinic, I'm a mix of traditional and functional kind of together. And if people choose weight loss medicine, I support them and try to guide them as
Yeah.
best as I can.
Yep.
But I hadn't thought about the slow motility with thyroid. And then those medicines also cause a slow motility. So in some people, it definitely could worsen the hypothyroid. I guess I just hadn't put that together. So thanks for that little light bulb.
Oh, yeah. No, I have a patient right now. She just started, but she was on the GLPs before,
Mhm.
walking around on T4 only with a poorly functioning thyroid. And she said she was constipated for 17 days. Like it shut down. Those things combined just shut down her gastric motility completely, like paralyzed her bowel.
Mm, mm. Well, and thinking through that another step, I mean, yes, the constipation's going to get worse, the pain's going to get worse, things of that nature. But also, that means you have more time to absorb things from your stool. And so you're just still readily absorbing nutrients and calories and energy and things like that. So it
Yeah.
makes sense why you could eat way less and then be gaining or not losing
Right.
on the medication with thyroid dysfunction. All right. So someone feels like they have a thyroid disorder. Their blood work is kind of okay in normal range. Do you notice with the eyebrow thing, the
Oh,
outer part of
yeah.
the eyebrow? That was something that I was experiencing. I recently started, or a couple months ago, started on your supplements, and I feel like my eyebrows are growing back now. I'm like,
Woo, nice. Yes, that's a big one. That's a big
yeah.
one. The loss
And
of the outer corner, or even just like thinning of your eyebrows in general.
yeah,
Yeah.
that's another one
Mhm.
there. Okay. So back to my next question was that someone comes in, their blood work is okay. They don't necessarily need to go on all out supplementation, but that doesn't mean things are optimal. You mentioned gluten. And in my opinion, nutrition is where you should start with everything. It may not be the complete answer to every health issue, but I feel like that's the place where you got to start because it's
Mhm.
what we're physically putting in our body that affects us. So when we're thinking about thyroid, what are your biggies for nutrition changes that someone could make on their own without even needing a provider to help them with?
Right. So gluten is the big one. And I don't care how many articles you read of people saying, well, no, it's not that bad. Yes, it is. Yes, it is. Because gluten has a molecular structure very similar to the thyroid gland. So if you do have Hashimoto's, and by the way, you might not know if you have it or not because doctors aren't too apt to test the antibodies,
Mhm.
or they'll test them one time and antibodies can come back as a false negative. So they'll test them one time and say, oh, no, you're good. You don't have Hashimoto's.
Yep.
Or they'll test you and you will have antibodies, but they're not flagged high. So
Mhm.
again, you get the misdiagnosis of, no, you don't have Hashimoto's, but you do. You have autoimmune. So
Mhm.
the rule of thumb is number one, yes, test, not guess. Number two, do you have autoimmune in your family? Does mom have Hashi? Does grandma? Does your aunts or sisters? Is it through your family line? And
Mhm.
then three, do you have another autoimmune condition? So any of those, and really, I mean, if you have a heartbeat and you breathe, I believe you should eliminate gluten and be gluten free. But
Absolutely.
definitely those first three are big red flag. So
Yeah.
what will happen when we consume gluten, and it's specifically the protein of gluten, which is gliadin?
Okay.
It looks to the body like the thyroid. So right now, if you picture your your body is full of soldiers. If you have autoimmune, you have these soldiers that
Mhm.
they think will take Hashimoto's, for example. They think that your thyroid gland is a bad guy, it's an invader. So they launch an all out attack. They go out and they attack your thyroid gland. Here comes a little gliadin gluten molecule, and your soldiers go, hey, there's another bad guy because it looks exactly like the thyroid gland.
Mhm.
They launch another attack. So every time you eat gluten, you're literally launching an attack on your body. And it's just, I mean, it's so inflammatory. It's going to downregulate your thyroid function. You're going to get worsening symptoms. So the 10 pounds will turn into 25. That fatigue will go up a notch and you're not going to be able to work. It just continues to get worse. And, Amanda, I have to bring this up. I'm sure you hear this too. The people that go, but it's too hard to give up gluten. It's like, okay, first of all, there's pretty much everything gluten-free in the grocery store now.
Yes.
Not that that's first choice, but my God, you can at least start there.
Yeah.
And then move on to actually making it yourself, maybe. I don't know.
Yeah,
So
well, I hear that too. And it's like, is it really? Because you're saying you're so fatigued, you can't move. You're saying all these things are happening. And if making that one change makes life 10 times easier.
Yeah.
I don't know.
I know.
Yeah.
I know. We got to call it out sometimes, right? Call people to the carpet. Like, it's not hard. It's not hard.
No, with those gluten-free products though, because yes, I have recommended those to people when they're getting off gluten, but I then find that people start to develop a cross sensitivity with like the tapioca starches and other things. And so if someone does go and choose those products, really a limited time, they don't need to be staying on those things forever.
Right. Exactly. Yeah.
Now, at our clinic, we also recommend trying low carb and sometimes eliminating the things that are going to stimulate insulin, because I do believe insulin resistance and problems with insulin tie in together with thyroid disorder. Do you tend to recommend people start to reduce carbohydrates further to lower their insulin, to lower their inflammatory pathways, things like that?
Yeah, it all depends on their labs. So we test insulin, we test hemoglobin A1C, we see if you are insulin resistant or borderline diabetic. And then, the hammer comes down a little bit harder on the carbs to where it's like, you need to lower your carbs. But it's funny because I spoke at KetoCon for the last 2 years and I'm speaking this year too. People always come in, my patients come in and say, are you going to put me on a ketogenic diet? Like, only if you need it. So it really depends on your labs. I mean, it depends. So some people, listen, if your insulin is beautiful and you're rocking like a 4 for an insulin level and your A1C is a 5, and I mean, your glucose is managed at an 86, can you add in some really good healthy carbs? Absolutely. Yeah. Go ahead. Have some berries, have a sweet potato. I still want to keep you in the realm of the good, healthy ones. But you can have more carbohydrates in a day than someone that has an insulin of a 15 and a 1C of a 5.6. And, for those people, there really is. You have to, and I'm sure you do that, you plug people in. Your labs tell us how you should eat. Yeah. You are going to get plugged in where you need to be. You might need to be less than 20 grams of carbs. You might need to be less than 50 grams of carbs. You might get away with 75 grams of carbs. But to your point, high insulin equals inflammation. So that really is where we have to focus. And I see insulin resistance go hand in hand with hypothyroidism. Yeah.
What about other foods like nightshade vegetables or oxalates, things like that? Do they play a role in thyroid?
Sometimes it just depends on the person. You might have those really sensitive people that are just sensitive to literally everything that goes into their mouth. And I hate to restrict so much that it makes someone miserable. I mean, ultimately the goal is let's get you on an eating plan you can do for the rest of your life and be happy. And not be, avoiding this and avoiding that and packing your foods, going to restaurants, right? We want you to be able to live life. But sometimes during a period of time, we might have to do an elimination. We might have to test and see how you do with these foods. The oxalates, I just started hearing people talk about that a few years ago. And of course, for me and my almond flour love, I'm like, no,
don't take it.
But, sometimes we have to look at truth and we have to say, okay, if you are reacting to this almond flour, even though you're adding it in to try to go low carb, right? Because keto recipes, paleo recipes, all use almond flour. If it's affecting you, well, then maybe we do switch flour sources. We start to play around with like tiger flour and, different things like that. So, yeah.
Okay. Do you find, you mentioned elimination diets, and I use that quite a bit in my clinic, especially, and I've used it myself. I was able to get off of medications for my psoriasis since I've I was 5 when I developed psoriasis. I ended up having to go carnivore for a little bit of time, like bare bones, and then slowly add things in and find what reacted with me. But do you find after people do, well, one, how long does someone have to kind of restrict strictly to kind of get all that inflammation down? And when they slowly add stuff back, do you find they then tolerate some things a little bit better after they've had a period of rest, basically, in the body?
Definitely. I mean, usually it's like a 30-day elimination, and then we start bringing things back in slowly. And some people don't even need to do that. So those that we have to do that with, you just start incorporating things in. And in that period of time of elimination, you're doing all the things. You're doing the gut healing protocol. We're getting your thyroid back online. We're getting your body shored up so that it can be more resilient and it can tolerate the little exposures to foods that maybe you reacted to in the past.
Yeah, absolutely. So let's kind of move into thinking about stress and sleep, because I feel like stress and elevated cortisol can almost trigger thyroid issues or worsen thyroid issues. And also thyroid can disrupt sleep. And then that kind of keeps the ball kind of going in a negative direction. So relate thyroid with stress and sleep and cortisol, that kind of thing.
Yeah. So this is a very intricate ball. So cortisol, we need cortisol. Cortisol gets demonized so much. Everyone's
So we have to have it just like we have to have insulin.
Right. It's needed for life. It's needed for life. So we don't want to suppress your cortisol to nothing, because that's a whole other problem as it relates to the thyroid. We want your cortisol pattern to be that pattern that it should be, where it's high in the morning and gradually comes down throughout the day and goes low at night. That's where we want your cortisol. Now, cortisol needs T3, but T3 needs cortisol. So what I'll see with people that have low cortisol, like total adrenal burnout, and it's very rare that I'll see that, but every once in a while I will see that flat line low. Those are the people that can't tolerate T3. We're looking at their T3 levels going, you're at a 2.6. We have to get that up. But you give them 5 micrograms of T3 and they're freaking out and they're anxious and their heart's palpitating. It's going through the roof and they just don't feel well on it. We need that cortisol to come up a little bit in order for them to tolerate the T3. Now, the opposite, the flip side of that T3 will actually push up cortisol. So sometimes we can use T3 to nudge that cortisol up a little bit while we're doing things to, like, adrenal glandulars or whatever you're using to nudge that cortisol up where it's supposed to be nudged up and support the adrenal glands. Now we go to high cortisol. Let's say you're running high or you have really higher spikes in that graph, in that pattern. That high cortisol will push up blood glucose, creating a high glucose state, an insulin resistant state. Now you have inflammation that's going to downregulate thyroid function. That's going to cause inflammation in the body. So that's going to affect even how the cells pick up thyroid hormone. So that's a whole other issue, right? So it's an interesting play. I've never been under the belief, nor have I seen it work, where just healing your adrenals will magically make your thyroid gland produce more T3. It's like, probably not. And that's going to be a long road. And the people who are sick and dealing with all those symptoms, they don't want to wait that long. They don't have that kind of, I mean, when they come to us, they're basically at death's doorstep, right? They're just saying, please, I can't do this anymore. You got to help me. I'm not going to take a year to try to fix your adrenals and then cross our fingers and wish on a rainbow that your thyroid gland produces more T3. It's like, let's do both at the same time. That's my whole theory and practice, is both and. We're going to treat your adrenals if we have to. We're going to treat your thyroid. We're going to treat your sex hormones. We're going to address insulin resistance. We're going to get you sleeping. And it might seem overwhelming, but in the beginning, that's what's going to get you the most bang for your buck, so that you're not in this symptomatic, downtrodden state for months and months.
Yeah. Okay. So when someone goes to a traditional medicine doctor, their thyroid's looking, or their thyroid levels are off, they're given Synthroid. Synthroid is T4, which is not something the listeners have heard you necessarily talk about, other than mentioning Synthroid before. But so T4 explain what Synthroid is and then the other options for thyroid treatment.
Yep. Let's break this down. So T4 is the inactive thyroid hormone. Your thyroid gland produces two hormones, T4 and T3.
Mm-hmm.
T4 is inactive, T3 is active. T4 has to convert over and become T3 because your receptor sites on your cells only have receptor sites for T3. So it has to go through this conversion. When we give you T4 medication, Synthroid, levothyroxine, there's a variety of different names for it in the UK. But when we give you that T4, your body has to take it and convert it over to become T3. And that's a really tough job. I compare it to running 5 Tough Mudders because there's so many things that can get in the way of conversion. So, and then a stat for you, for your audience, is that only 2% of the population does well on T4 only. 98% need T4 and T3 combined. So when we give you T4, which that's what I was given T4, gave it that 5 months, no change. Because that T4, number one, was not properly converting. And number two, I'm not of that 2% that do well on T4. So I needed a combination. So now we move into T3. Okay, T3, liothyronine, cytomel. And both of these are synthetic, but I hate that term. I call it biosynth. I don't know. I just made that up. Biologically, right? It's like the bioidentical hormones. They're biosynth. They're biologically identical to the T4 and T3 that you make. But yeah, they're synthetic. Sometimes, most of the time, you need that. I mean, I find that more people do well on the synthetic blends, and then that gives me the ability to change the ratios too. So if someone's reverse T3 is high, I can bring down the T4 and go up in the T3. As opposed to the third class of thyroid medication, which are natural desiccated thyroid meds. This is your Armour, your NP, the Days of Old of Nature-Throid, or compounded T4, T3. The problem with that, they're using porcine thyroid gland. Some people do very well on it. Some people don't. And it really is about finding how your body's going to respond. But the NDTs are 80% T4, 20% T3. So if someone's doing really well on it, their reverse is great, but the T3 is low. Hey, we can just add in some liothyronine to the Armour and keep it the same. If we go up in the Armour and we go too high in the Armour dose, now you're pushing up that T4. So now you remember 80% T4. So if we increase Armour, you're going up in the T4 dose, and you're only getting 20% bumps of the T3. So sometimes you have to do different combinations. But the bottom line is you got to find what's working for you. And you have to find what blend is going to fit your body the best to get you optimized.
Gotcha. So if someone's working with a traditional medicine doctor and they're only willing to prescribe Synthroid T4, and I will say in my area, we don't have a lot of functional medicine, and most of the doctors prefer T4 only because it's easy to manage. You just kind of look at one number and change the dose based off of that and expect people to get better. I was guilty of it at the beginning of my practice, but is there something the individual can do outside of their Synthroid to help convert to T3 a little bit better?
You can. So the things that help with conversion, iodine will bring down reverse T3. I'm a huge fan of that. Magnesium, selenium, those are very helpful. Your vitamin D levels being optimized helps as well. You want to control your insulin. You want to make sure that you're not estrogen dominant because high estrogen levels and then insulin resistance will absolutely push up reverse T3. Just getting all your sex hormones in line. This is where sometimes I'll add in T2 to help someone with the basal metabolic rate and their energy. So we can kind of, if someone is stuck on T4 only, then we can add in the other that I call the forgotten thyroid hormone T2. We can bring that in. So there's a variety of different combos that we can do to really help push that conversion.
Gotcha. And so if someone doesn't necessarily need they don't need T3, T4. They're okay. And not everybody needs it, but you still may have symptoms. What should that person look at? You mentioned T2, and I know you have a great supplement line with T2, but is that something that's safe for anybody to take and try out if they feel like they're having thyroid symptoms, but their blood is not necessarily needing direct supplementation?
Yeah, definitely. So the cool thing, I've been studying T2 for 15 years now, and the chemical structure name is 3,5-diodo-L-thymine is the big long name. But T2, it's cool because number one, it is a thyroid hormone. We
Mhm.
find it in those NDT medications in Armour and NP because it's actually produced by the thyroid gland. However, and it's a very potent thyroid hormone, but
Mhm.
it doesn't have an effect on the thyroid itself. So why do we care about that? Because in taking thyroid medication or even taking T3, you're going to have a negative feedback loop with your thyroid where it's naturally going to cause the thyroid gland to shut down its own production because our system senses that there's enough thyroid hormone here. We don't really have to produce any of our own. And then sometimes you can get, not with T2, but with T3, you can get these number changes where your TSH will go down. And then your conventional medicine doctor will say, oh my God, you're hyper. And I'm going to pull all the medication from you. And then you just end
Yeah.
up feeling worse, right? So T2 works at the mitochondrial level. So it works to increase your basal metabolic rate and it improves mitochondria function, improves ATP production. So it helps with increasing the amount of fat that you're burning at rest and increasing your energy, but it's a nice, gentle, steady state energy. It's not a jittery, caffeinated energy. So yes, anyone can take it. I mean, I get this question all the time. Well, can I take Thyroid-Fixer if I don't have a thyroid problem? I go, well, yeah. Do you want to lose weight or do you have trouble with energy? They go, yeah, then you can take it. I mean, because it is increasing your BMR and it's improving your energy. And then it has a host of other, it helps with lipid panels, it helps with cholesterol, helps with insulin resistance. I mean, it has a host of other benefits as well.
Yeah. Awesome. Awesome. And like I said, I started that 2 months ago, and I've definitely seen a difference in my energy. I've seen a difference in my sleep at night. I feel like I'm just getting there a little bit easier.
Mm-hmm.
Feel better overall. And my eyebrows. My eyebrows are
Yeah,
getting
yeah,
better.
nice. We hear that a lot. We do. We hear the sleep, we hear the hair. Obviously, we hear the weight loss and the energy. Yesterday, after coming off just a week of craziness,
Mm.
for the first time, I never get tired during the day. I mean, I'm pretty optimized. I don't get those heavy eyes, right? But
Yeah.
yesterday, I was struggling. I was battling through the day, and literally, I reached behind me and I grabbed the bottle of Thyroid-Fixer I have here, and I popped two. And it's amazing. Like, I'm even sometimes amazed what it
Yeah.
does to energy because normally I don't, like I said, I don't feel the low energy, but then when I do and I get to try it out, I'm like, oh wow, okay, this is nice. And it got me through the rest of the day.
That's awesome. That's
Yeah.
awesome. All right. So you had mentioned estrogen dominance, insulin resistance, and this is a term that I think a lot of people have heard, but they don't truly understand.
Mm-hmm.
But I see it all the time. I,
Yeah.
I mean, ladies walk in my clinic. I'm like, yeah, you've got way too much estrogen going on. Yes. So explain what estrogen dominance is, what that person looks like, and how it interplays with insulin.
Estrogen dominance. So estrogen dominance can either be high total estrogen. So you get your total estrogen tested and it's flagged high, or you
Mhm.
get your estradiol tested and it's flagged high. So it can be the obvious estrogen dominance where you're actually flagged, you got a little H next to it, or it can be estrogen dominance as the ratio of progesterone to estrogen goes. So when we look at progesterone, most of the time, even starting in a woman's 30s, the progesterone levels will start to decline. And we even see it in teens and 20s in
Mhm.
women that have polycystic ovarian syndrome or they just
Mhm.
have low progesterone in general. Now, what the young girls will get is they'll get birth control to bring up their progesterone. What they
Mhm.
should be getting is progesterone, the real kind, the bioidentical kind. So we can use progesterone at any age. But what we'll see is this low progesterone state with a normal estrogen. Let's say progesterone is coming in at a 0.5 and your estradiol is a beautiful like 135. Well, that's still an estrogen dominant state. And it's not that we need to change the estradiol number, we need to bring up the progesterone. So it can be one or both, either or. But then we can also have to bring in the xenoestrogens, the fake estrogens that we are exposed to in our daily life, from chemicals, to what we put on our body, and to the plastics. And that can actually cause an estrogen dominant state as well, where we're actually not even detoxifying our own estrogen. If you're not pooping every day, you are not properly detoxifying your own estrogen. So that's another component too.
Okay. You mentioned environmental estrogens. What's your feeling on soy?
Yeah. Hate it. Don't like it. Don't like it. Soy is not good for the thyroid at all. It's not.
I just said it's not good for the whole body. It's
just
meant
not.
for cattle, in my opinion, not necessarily for humans.
Yeah, I mean, honestly, and I mean, men who take it end up getting man boobs. They go into an estrogen dominant state.
Yeah.
Women who take, I remember back, oh God, I don't know how old I was. It's probably my late teens, early 20s when we had the whole soy craze kind of come out, right? With soy protein and soy milk and edamame.
Yeah.
And so I'm like, well, this is healthy. I broke out like I was like 12 years old going through puberty. And it was because I put myself into an estrogen dominant state with the soy.
Yeah. Yeah. You know, I think any whole foods diet has the potential to be a healthy diet if you pay enough attention to what you're eating. But my main concern with a plant-based or more of a plant slant diet is the high amount of soy that you would have to consume to get enough protein in if you're not consuming any animal products. And I just think that can change your thyroid function, your hormone function. I think that's a very difficult diet to balance.
I agree. Yep.
Yeah. So back to estrogen dominance. What type of symptoms is that woman going to have? What is she going to look like when she presents in front of you?
Weight gain, water retention, kind of bloated kind of feeling, possibly more emotional, irregular cycles. That's usually what I see with the E dominance.
Gotcha.
Yeah.
Let's touch a little bit on that. You mentioned the synthetic versus bioidentical hormones. And when we're just talking about the sex hormones, estrogen and progesterone, I think there's a big difference between the bioidentical and the traditional synthetic hormones that are out there or what you can get at the regular pharmacy. What is your opinion on the differences between the two and which one works a little bit better with the body?
Doesn't matter.
Doesn't matter.
I get that question all the time. They're like, what's your favorite thyroid hormone? I go, the one that's going to work for you. Because I mean, and I haven't studied this deeply, even anecdotally. I can't really say that there's a definitive correlation, but I have seen some people mention and some studies say that the porcine version of like the NDT actually doesn't do so well with Hashimoto patients, with autoimmune patients. Now, will I have Hashimoto patients do well on Armour? Yes, I will. So that's where it's like, it doesn't quite 100% correlate with me, but I can see where, because you are in that more reactive, more histamine intolerant state, sometimes people just don't do well with the porcine version. You know, they need it a little bit more. Yes, it can be argued that the pig thyroid gland is close to our thyroid gland, and then it looks the same and acts the same, produces the same. However, I just find some people, we have to find what's going to work for you. Some people do better on the synthetics. I do better on the synthetics. So yeah, it's about tailoring it to you. And like I mentioned earlier, sometimes we can do a blend. So we can do the NDT with like the T3, the liothyronine.
Gotcha. What about when it comes to like hormone replacement, estrogen, progesterone?
Oh, all day long. Only bioidentical. Never synthetic.
Yeah.
Right. And that's where the whole confusion comes in with women who say, I don't want to do hormones because it's going to give me cancer. No, that's not true. The Women's Health Initiative study was the largest, most poorly done, most expensive study in history. And it was done using synthetic hormones. It was done with women that were 10 years past menopause. They didn't even check to see if they had any pre-existing conditions. So, and that caused a fear because then they extrapolated that hormones cause cancer. Well, it was a very small percentage of those women. They started the hormones too late, and they used the synthetic hormones. And we can't we cannot blanket that now over into the bioidenticals, because the bioidenticals actually prevents cancer. They protect our heart, our bones, our brain, our skin, our muscles. And to those people that say bioidentical hormones cause cancer, how many 14, 15, and 16-year-olds do you see walking around with cancer and Alzheimer's and dementia and osteoporosis and cardiovascular disease? And yeah, I just don't. So hormones protect the bioidentical. Yeah.
Yes. So the answer in medicine has just been a pill for this, pill for that. Just the last 20, 30 years. I've been in medicine now for 20 years, and I feel like it's just the next best pill, the next best medicine. But I feel like a lot of our medications actually block our natural hormone production, specifically in thyroid, or might impair our ability for our thyroid to operate appropriately. What are the big ones out there that you see have disrupted thyroid dysregulation or caused issues, the big medications that people need to be evaluated for?
Birth control. Okay. Birth control is a huge one that will downregulate the thyroid. The Band-Aids that I don't know that they necessarily hurt the thyroid, but they hurt the person, because all they are Band-Aid medications, and the person probably doesn't need those meds. They need their thyroid fixed. The antidepressants, the statins, the blood pressure medication, the sleeping pills. So whenever, and even the ADD medication. So whenever I get a patient on, I have a patient come in, we're working together, I'm seeing that list of meds, I tell them, like, listen, we might be able to get you off of these. These are truly Band-Aids. Because once we start fixing your thyroid, you might find that you don't need that antidepressant, because now your brain's all lit up and you feel better. And even when we start replacing hormones, I mean, progesterone is the calming hormone. It's a natural anti-anxiety hormone. Estrogen helps fuel the brain. Testosterone gives you motivation. So you might not need that. Testosterone protects the heart. You might not need that statin. You might be on a statin anyways, and you don't even need it. So there's that. So there's many meds that we might be able to get you off of if we get to that root cause.
Yeah, for sure. And you mentioned statins. We have such a fear of cholesterol that's built up in the country, but cholesterol is an important thing, just like insulin is an important thing, and cortisol is an important thing. And if you don't have enough of it, it's going to impair your ability to make those beautiful hormones that keep us happy and healthy.
Right.
So, yeah. Okay. What is your top 3 things of advice for someone who is starting down the journey of optimizing? What are the big 3 things that they could go start working on right now?
So let's say you have a thyroid problem. You've been listening to us today. You are in tune with all the symptoms that you're dealing with, and you just don't really know how to fix it. Number one, I would say get the proper testing. Get all of the testing so you have all the data. And if your doctor says no to testing, it's time to get a new doctor. So get all the testing done. And then I would say look into what kind of hormone replacement you need. So it's not just about thyroid. We want to test your hormones as well. The estradiol, the progesterone, the testosterone, DHEA. We want to look at all of that too, because sometimes hormone replacement is involved. And then just the proper supplementation with the nutrients that we talked about, the iodine, the mag, the D, selenium. I hesitate because too many thyroid patients pop selenium like it's going out of style. And you actually don't need that much. Eat a Brazil nut a day. How about that? So make sure you're getting all your nutrients in line, because that will help support thyroid function as well. And I'm adding in number 4. Number 4 is go gluten-free. We talked about that. I mean, that's easy breezy to do, and it's going to help your body tremendously.
Oh, absolutely. Okay. If people want to learn more about you, your practice, listen to your podcast, tell them where they can find you at.
Absolutely. So the podcast is the Thyroid-Fixer podcast, and that's on all podcast platforms. And then we do have a public Facebook group. It's called Girl Fix Your Thyroid, which anyone can join. You can jump in there. You can ask questions. You can post your labs, so we can actually give you feedback. Myself, my team, and even some really well-trained, optimized patients are in there answering, because they know what I would say. So they're in there giving you feedback as well. And you can go to my website at dramihornaman.com. And if you are interested in learning how to work together, you can book a call. You can find my supplement line on there as well. And then, of course, all social platforms at Dr. Amie Hornaman.
Absolutely. So check out her site. It's a wealth of information. If your doctor will not order your labs, there's a great place called ownyourownlabs.com where you can go and order all of those tests yourself, and then maybe go on a platform like the Facebook group and get opinions of other people, so you can take your health into your own hands if you need to. So Dr. Amie, thank you for joining me. I've appreciated your time and loved the discussion, and maybe we'll continue again some other time.
Thank you.